Exciting seminar. I'm Paul Wise, professor of pediatrics, health policy, and a member of CSAC and CDDRL. And I have the privilege of introducing Ruth Gibson, postdoc here at CSAC, presenting an important presenting on an important issue today. Ruth who's a postdoctoral fellow and has background and master's in public health, a PhD in maternal and child health, but has been pioneering cross-disciplinary work linking maternal and child health, public health studies with international security. The focus of her work that she'll be presenting on today is on the impact of geopolitical sanctions, particularly aid sanctions, as a tool in political security studies and interventions, and its impact ultimately on vulnerable populations, particularly women's and children's health. So let me turn it over to you, Ruth, and lead the way.
The most common tools of geopolitical coercion do not involve bombs and bullets. Rather, they use non-military coercive strategies such as diplomatic isolation, various types of sanctions, and prohibition of humanitarian aid. Non-kinetic coercion is the most common strategy used in geopolitics, and its impact on the human health are not clearly understood. Kofi Annan wrote, "Sanctions are a necessary middle ground between war and words. But in reality, there is not a linear progression from diplomatic conversations to sanctions to war. Geopolitics does not work in a linear way. Sanctions are used to prevent wars, to stop wars. They're used instead of diplomatic conversations. Sanctions can be used by multiple countries at the same time, and multiple types of sanctions can be used against the same nation all at once." So today I will draw your attention to how women's and children's health is impacted on sanctions, with a focus, as Paul said, on one of our recent projects on aid sanctions and maternal and child mortality. And I will also update you on developments with the United Nations Human Rights Council and an international effort to develop a universal system of monitoring to assess the impact of unilateral coercive measures on human rights. So understanding the impacts of different types of coercion on vulnerable people is essential for designing more effective international policies that address these points of disagreements between nations while minimizing collateral damage to human health. So physical health metrics are but one indicator of the impact of these coercive measures, but my expertise is in global maternal and child health, and thus our discussion today will be focused on the impacts of sanctions on maternal and child health. So prior academic research has focused on the consequences of sanctions for civilian populations in sanctioned countries, but the focus has been on individual case studies. So country examples. So in 1993, the Harvard Center for Population and Development Studies report, Sanctions in Haiti, Crisis for Humanitarian Action, showed that the economic hardship in Haiti led to the deterioration of the healthcare system and subsequently an increase in child mortality and malnutrition. The author said, "We have reason to fear that this could have resulted in 20,000 excess child deaths and about 100,000 excess cases of moderate to severe malnutrition in under 5 children." So in 2019, Mark Westbrook and Jeffrey Sachs, they published a report on US sanctions against Venezuela, and they highlighted the impact on the civilian population. So in their report, they estimated that 40,000 additional Venezuelans, which was an increase of 31%, died in 2017 and 2018 as a direct result of the comprehensive economic sanctions imposed in August 2017, especially the US Executive Order 2019 that cut off sales between Venezuela and the United States, previously the largest purchaser of Venezuelan oil. But the author's calculations have been criticized and blamed by other scholars, including Ricardo Hussman, who said, it's understandable that the authors don't agree with sanctions to pressure Venezuela's dictatorship, but it is not understandable that they would misrepresent their effects with sloppy reasoning. So this tension speaks to part of the social problem. Sanctions are essential geopolitical tools, but their impact on people is contested politically and it's disputed academically. So I want to share some overarching findings from our ongoing research. The first is that the poorest and least developed countries are most likely to be the targets of sanctions, that nations have strategic vulnerabilities to certain types of sanctions. So the characteristics of the target country make them vulnerable to certain types of sanctions. And our work in this area is focused on identifying those countries with strategic vulnerabilities to sanctions that impact maternal and child health outcomes. Conflict exacerbates the impact of sanctions and the deterioration of health outcomes. So our work has shown that the boundaries between sanctions and armed conflict blur, with periods of sanctions also often being interspersed or occurring simultaneously as periods of armed conflict. So it's important that an investigation of the impact of sanctions and health outcomes include an assessment of the spatial and temporal relationship between sanctions and armed conflict. But one major piece missing from the academic literature is a global analysis of how specific types of sanctions impact health. So what's required here is global or panel analysis to be able to understand what this specific type or what any specific type of sanction, what that sanction does to human health. And there's one question that I've wanted to answer since 2010, when I took a job as a CEO of a humanitarian foundation in Madagascar focused on women's and children's health. So Madagascar is an island in the middle of the Indian Ocean, and it's one of remarkable beauty and biodiversity, and it's a country and people that I love. But it's also one of the poorest nations on earth. And in the 3 years I was there, I watched the Malagasy people fight to survive locust plagues, the bubonic plague, and environmental disasters because of environmental disasters impacting crops. So to add to this mixture of human suffering, in 2009, the year before I arrived, the military had overthrown the democratically elected government in a coup d'etat. And the response from the international community was understandably to sanction aid. And these nations include the African Union, the European Union, and the United States. So aid sanctions are a type of financial sanction that is used by high-income nations against lower-income countries to punish armed conflict, coup d'etat, election fraud, and human rights abuses. So aid sanctions fall into a category of international law known as retortions, which are acts that are unfriendly but not unlawful. And they can be used regardless of whether or not there has been a prior violation of international law, and there is minimal restrictions on their use. So over the past 3 years, a group of academics at 3 universities have teamed up to answer the research question: what is the impact of aid sanctions on global maternal and child health outcomes? And I want to briefly acknowledge my colleagues on this project before I tell you what we've managed to do. So my colleagues are Professor Paul Wise, Michelle Berry, and Aron Ben David from the Stanford School of Medicine, Drexel University professors Yoto Yotov and Sebastian Bradley, who are both econometricians, Dr. Sasha Kuralaka, who's an economist, and from the University of Washington, Dr. Joseph Delman, who runs the Institute of Health Metrics and Evaluation. So to answer our question, the first thing we needed was a data set. So we created a data set on global aid sanctions by searching the 4 previously established databases on sanctions, looking for aid sanction cases that had already been captured by previous academics. We then added all the aid sanction cases by the European Union by searching the Council of the European Parliament. Then we added aid sanction cases from the US Department of State, from US executive orders. And for each individual and nation and regional body that was involved, we looked at online search engines and then confirmed with official government websites and statements of policy orders. And lastly, to confirm that we had done things correctly, 2 co-authors conducted a peer review process at the end. So our final data set has 201 cases where each case is classified by the sanctioning country, the sanctioned country, the year imposed, the year that it was lifted, if it was ongoing, and then the reason for the sanction. So after we had our data set, we continued with the econometric analysis, and we wanted to understand 4 main pieces here: the relationship between aid sanctions and official development assistance, the relationship between aid sanctions and official development assistance for health, to confirm that official development assistance for health and impacts on maternal and child mortality, and aid sanctions and maternal and child mortality. So those 4 things. So for each piece of that question, we used different data sets, which we can talk more about in the question and answer period. But one of our main concerns was that the results that we had controlled for other variables that could impact mortality other than sanctions. So we also needed to control for factors that may influence the imposition of sanctions. So for battle-related deaths, we looked at the Uppsala Conflict Data Program, which has data on organized violence, civil war, and armed conflict. And we looked at GDP from the World Bank development indicators. So I'll tell you what we found. So there are 67 low, middle, and middle income countries in our study that were targeted by aid sanctions between 1990 and 2019. So our results show that aid sanctions resulted in an average reduction of 40% in official development assistance and 21% in official development assistance for health. The significance of that is that low-income countries, 30% of their budget is reliant on this official development assistance for health. In terms of the impact on maternal and child health, for infant death, we found a 3.1% increase, for under-child mortality a 3.4%, and for maternal a 6.4%. Now, what we need to do here is we need to compare these numbers to the annualized rate of improvement in these 3 metrics over a decade. And when we did that, our results collectively showed that aid sanctions resulted in a 70%, that aid sanctions erased approximately 70% of the annualized rate of improvement in these countries over the last decade. So my goal with this project is to constructively influence policy change for aid sanction use. But there's an even bigger issue that has been unresolved since the early 1990s. And that is, after 3 decades of research on human health and sanctions, there's no international tool for assessing these impacts. And there's a need for a framework that would allow both the sanctioning countries and international monitors to foresee and document the specific impact of sanctions on human rights, including health. So numerous scholars, as well as the United Nations, have stressed the importance of this system of monitoring. UN lawyer Jeremy Farrell said that humanitarian impact assessments should be conducted for all sanctions regimes, and these assessments should occur in advance of the application of these sanctions and at regular intervals once the sanction regime has been applied. And the UN Security Council should make sure that its members have such assessments sitting in front of them as they are designing a sanction regime. So in October of 2022, so last fall, a small group of scholars at the Center for Innovation in Global Health and I responded to a call from the United Nations Human Rights Council for contributions towards this universal system for an empirical model of monitoring the impacts of sanctions. The overarching goal here is that we develop an analytic system capable of assessing both the potential and actual humanitarian effects of sanctions, and then have it adopted into international law. So the project is led by the Human Rights Council, with universities around the globe being responsible for specific humanitarian clusters. So in March of 2023, just this last March, the Human Rights Council had a week-long meeting, which I attended as an expert from Stanford in maternal and child health. And the meeting merged academics from around the world involved in this project, diplomats, international lawyers, and politicians. So we identified numerous challenges with the methodology. We had many conflicting views between nations and between parties among the metrics that would be used, especially around child and infant mortality from the sanctioning governments, and discuss solutions for these challenges. So the team responsible for development is Columbia University, and Professor Jeffrey Sachs, who I talked about earlier, proposed that for this empirical model that we'll use with the Human Rights Council, that we merge the model that I just described to you for aid sanctions that we built with our colleagues at Drexel, with the one previously developed by Sachs, into a single quantitative methodology for the econometric analysis of the impact of sanctions on these humanitarian clusters. So the methodology is currently in discussion. But we outlined 4 fundamental steps. The first, we have to model historical data on sanctions and human health. So the existing data that we have on the impact of sanctions and health can be used to predict future impact. And that's what we've already done for aid sanctions and maternal and child health. We have to identify nations with strategic vulnerabilities to these sanctions. We need to monitor the humanitarian outcomes, because these slow-running variables, such as mortality when people die, they're not as useful as the intermediary variables to capture human health suffering before death. And lastly, to advocate for sanction modification based on the results of these humanitarian impact assessments. So this project is too large for any one university to handle alone. So Professor Paul Berry, Paul Wise, Michelle Berry, and some of our colleagues at the Center for Innovation in Global Health, we're responsible for the cluster, the humanitarian health cluster of health. So the special rapporteur for unilateral coercive measures will submit this entire framework, this universal system of monitoring, as a resolution to be voted on by the 47 member nations of the Council in September 2024. And a successful Human Rights Council vote on the resolution would ensure the maternal and child health outcomes are tracked as part of sanction regimes. And the intention is for the UN Office of the High Commission for Human Rights to take over this project within 24 months, as this project will require nation states and NGOs to update the World Health Organization on new data. So this particular project could contribute to protecting the lives of millions of vulnerable people by providing countries and overseers with a tool for predicting and monitoring the impacts of sanctions. Stability in a sanctioned country's healthcare system and maternal and child health outcomes are an essential part of global geopolitical stability and thus compatible with the goal of sanctions. I look forward to our discussion.
Thanks so much, Ruth. That was really an excellent presentation of both the challenge and the findings to date, the progress you've made on the project. I want to turn first to Alan for a question, and please let me know any questions, comments here in the room, and we'll be also tracking on the chat for those tuning in virtually.
So it's a wonderful project, and I think for a long time there have been very sweeping normative claims about the effects of sanctions, and it's really, really great to have some effort to analyze it and to figure it out. So I think the contribution that you're making here is really extraordinary. I have a comment and then a question, or maybe two questions, two-part question. Comment is, I'm a little curious about, in some ways, even the framing of this as sanctions. Right. So, there's been a huge evolution in the way economic sanctions have been practiced over the last 30 years. Right. And it used to be that they were very punitive, and, you would cut off trade, you would impose really significant restrictions on people to move money in and out of the country. Here, we're talking about things like you can't have access to my market, right, if it's Venezuela, or we're not going to give you development aid, right, which is like, largesse, right? So in a way, like the withholding of a benefit seems to me to be different than the way we've thought about sanctions, again, in the 1990s when we did Iraq, right? So I'm wondering if there's just what you're thinking about the way that we frame this, right? If I choose not to give you development aid, is it really, which I'm not obligated to do, is it really right to think about that as a sanction? Then the question is, okay, so one can imagine the result of this. All sanctions are presumably going to have negative, social impacts, maybe beyond what are intended. So can you highlight for me, I'm not sure I caught it in the paper, in the presentation, how much your work focuses on health impacts as opposed to broader socioeconomic impacts? Because I think if the recommendation is like, well, we shouldn't do any sanctions ever because they're harmful, that's going to be a recommendation that states are going to have a hard time accepting. But if you can really target the health impact, I think that's something that states are going to be maybe much more likely to be responsive to. And we've already seen significant movement in the idea that there shouldn't be the kinds of more traditional coercive sanctions on trade and, health, food and medicine, for instance.
So, given that you're an international lawyer, there's an enormous amount of debate even about the term sanctions. And when I was at the Human Rights Council, there was a great deal of banging on the tables and shouting about people in the meeting not using the word sanction, that the term should be unilateral coercive measures or coercive measures, and only that, because of the fact that how we're defining sanctions and whether or not it's even legal. And I have to leave parts of that debate to international lawyers. I think that the first part of the question that you asked me was about development assistance and a development assistance for health. And am I saying, is my academic argument and are the policy recommendations that I'm making here that's problematic when there's a political event and then we take away our gift, because it is a gift, right? There is nothing legally binding when I, as nation A, give you as nation B hundreds of millions of dollars and then it's revoked either entirely or in large part. So I think whether or not I use the term sanction or unilateral coercive measure is because part of what I'm trying to do here is speak to a global health audience and eventually speak to a policy audience. And so I'm trying to use words that will be understood. What I am saying is that it's problematic when the amount of money that is given, and this has been proven over decades in the global health literature, is cut off, or when it's dropped substantially. And what I'm part of my argument in that first piece of research that I presented to you is that there has to be a titration of our response. And what I'm proposing in terms of policy recommendations is that sanction regime planning include what other nations are doing. So if every regional body, the European Union, the African Union, is cutting this humanitarian aid in response to an event, is it necessary for a country such as the US to provide to cut entirely? So my academic and like personal belief system is that sanctions are essential. We need them, and the case study, this case study instances, if you break it down by country, the results are varied. Sometimes things improve, right? Globally, what I shared with you, those results is you're going to see a decline. We still need them, but we have to watch what's happening.
Cameron?
You,
We've got a lot of people lined up with
okay.
questions.
I had a methodological question.
What's your name?
Cameron Tracy, research scholar at CSAC. So it sounds like aid sanctions are often prompted by changes in government, especially disorderly changes like coups. I'd imagine those changes in government could have effects on things like childhood mortality, regardless of whether aid sanctions were imposed due to things like the breakdown in governmental provision of health services. In your analysis, how do you control for that? That is, how do you distinguish between things like deaths caused by, deaths resulting from the change of government versus deaths resulting from aid sanctions imposed as a result of the change in government?
So in any econometric model, like we've controlled for as many of the pieces as we can in terms of the data that's available to us, right? So I shared that we've controlled for armed conflict and battle-related deaths. We've looked at government transition points from various types of governments to another. That hasn't, to the best of my knowledge, and I can write to you after I ask the econometricians who have built this, that isn't being built into the model. And I think that part of what I've learned in these debates is that when you build an econometric model, or when you attempt to demonstrate anything statistically, like pieces of it can be torn apart because the argument can be indeed when I use the example of Madagascar, how are you going to control for the locust plague? How are you going to control for the bubonic plague? There's so many pieces to this, but my colleagues who built this model, like when we control for as many of the variables that are available to us, aid sanctions alone are increasing mortality in these three metrics. So no econometric model is perfect, but we've controlled for as much as we can in terms of what's happening in the country. GDP is a big one. We can't control for government transition or locust plagues.
Rose?
Thank you. This is really an eye-opening presentation, Ruth. My question is more related to what I understand to be kind of standing policy, at least in Washington, and that is when they come up with sanctions packages, they often articulate that this will not affect the people of the country. This is to go after the leadership. It's to go after, in the case of Russia, the oligarchs. I know the Russia case best, so I'm probably reflecting too much on that. But is that not common across these, that the United States at least articulates a desire to preserve the flow of assistance to the vulnerable, or am I wrong about that?
So it's explicitly stated in section 7008. So the US foreign aid appropriations in response to military coups, that political response is not intended to affect humanitarian aid or official development assistance for health, and thus will not impact the civilian population. So like my understanding of state policy decision-making, USAID decision-making, is that these political responses, the one that I particularly presented to you today, is thought to sanction to that mechanism of aid sanctions, whether or not we're going to call it aid sanctions or unilateral coercive measures, but to impact military assistance and different types of assistance. So I think that this is not known, and I'm excited about, in the coming weeks, trying to get this in for publication and being able to make that available to you to begin to share so that we can have those discussions.
As I said, it's eye-opening. Research is very important.
You had a comment?
Hi, Ruth. I'm Julie. I'm a predoctoral fellow here at CSEC and at the Institute for Human-Centered AI. Thanks so much for your presentation. I learned a great deal. I have a question about your fourth fundamental step in moving forward about sanction modifications. And I'm picking up on what Alan had asked and commented on, but I was wondering if you could tell us in a little bit more concrete details of what these modifications could look like, especially for strategically vulnerable countries. I think you mentioned about titration and funding or aid, but are there other types of measures that the United States could do moving forward? Thanks.
So to be able to answer that question well, I would need to understand the current decision-making pathway that is happening in government. So how sanction regimes are put together, and then how long they're held in place. The data set that I've used for both my doctoral research and the creation of this data set, it's in most instances, like, sanctions are used to stop a certain behavior in the targeted country, or to influence behavior, and the sanctions are lifted when that event shifts. So the simplest one is my coup example, right? You have the military overtake the democratically elected leader, and then you sanction. And then when you send in international observers to monitor the next democratic election. And when that is deemed to be democratic, you lift it. Or with human rights violations, you sanction around human rights violations. And when it's deemed to be at a level of improvement that is okay, you lift, or is in a similar instance of armed conflict. But what I'm trying to say, that's a political shift in most instances. What I'm arguing is that we need to be watching that the international community, through the Human Rights Council and then the sanctioning countries themselves, that they're provided, like, my belief is that if the US State Department has before them that in, like, these series of countries in West Africa that have gone through sanctioning events, we're seeing a sharp decline in these intermediary variables of human health, right? Like, the US has presence all over the world and has programs to improve human health, right? Like, that's part of what, I'm a Canadian by citizenship, but I work here and I believe in what the US is trying to do. If we're seeing a sharp decline here, things are getting worse. Perhaps we should lift, perhaps we should modify, perhaps we should provide support in other ways that it is possible for us to, because these are long-term, presumably long-term strategic partnerships in countries of interest. So that's broadly the thought process here, both my academic perspective, but also that of the work that I shared with you of what's happening with the Human Rights Council.
Got Scott, Dean, and then Harold.
Ruth, my question may be in the report that you're working on, but it wasn't in the talk. And it was sparked by your phrase about you're trying to understand the characteristics of individual states that produce their strategic vulnerability.
Yeah.
And I would think that that term could mean one of two different things. One is whether that state or that government is likely to be vulnerable to sanctions in terms of it changing their behavior.
Mhm.
And the other is whether it is what, for lack of a better phrase, you could say collateral damage vulnerable. That is, there's something about the state structures and the healthcare system that make it particularly vulnerable. And I would want to see those compared somehow, because
Yeah.
one way of thinking about this would be that you're trying to have a proportionality assessment. That is, these tragic losses, unintended, have still, for some countries, might produce a more rapid election, for example. In other cases, they might not. And you'd want to know that. Is there a way that you can do that? Do you have data that would permit you to do that kind of comparison?
Well, firstly, thank you, because the part of the question of, Ruth, do you mean strategic vulnerabilities, by which you mean the nation is strategically vulnerable to change, like you can influence change through this mechanism? That hadn't occurred to me as a piece of what that could mean. When I use the term, and when Paul and I have been having these conversations, and in our assessment of the health impact, it's been whether or not these nations have. So, for instance, one of the findings that perhaps you will not find surprising is that middle income countries are more susceptible to any type of sanctioning mechanism that impacts the economy than low income nations. Now, that makes sense if you break it down, right? Because low income countries, if you're looking at human health, things are truly abysmal to begin with. If you're spending $2 a person for every person in this room, and then I tell you, Scott, I'm sorry, can't give you $2 a person, I'm going to give you $1.80. Like, you would not see significant changes.
Collateral damage vulnerability would be the way to. I'm not sure if that's the right term.
Well, but it's an important term. Let me just break in that you're using just war language,
Right.
Proportionality, collateral damage. And my question, we could wait until other people's questions have been addressed, is what in fact is the appropriate framework for non-kinetic geopolitical sanctions that are non-kinetic, but they're lethal. In other words, in a sense, the innocents, the non-combatants are being harmed. As you know, my focus has been on indirect effects of violent conflict. This would tend to fit into the same kind of ethical/empirical framework that has rarely, if ever, really been applied to understanding the true impact of sanctions. So my question is that appropriate, and what kinds of revisions would be required to use a just war framework to begin to assess the ethical and empirical implications of a revised sanction analysis? But let me hold off on that. And Dean, you're next.
My name is Dean Winslow. I'm a professor of medicine at med school. And again, I think just might have kind of a question and a comment, both really, I think, reinforcing maybe some of the points that both, Scott and Paul were making. But, my own personal experience is, with Iraq, and I served, actually 4 different combat deployments before the second Gulf War, and then 4 after, 9/11. And, we I wondered again, just my concern about developing a model is just because it seems like there's so much heterogeneity, between different regimes and the type of sanctions. So, for example, in Iraq, which I'm sure you looked at a lot, in developing your model, the sanctions that we had was largely an oil export embargo, beginning after the first Gulf War, because Saddam wouldn't let weapons inspectors in. He never changed his behavior. And certainly, though, when we actually went in on the ground in Iraq in '03, we saw just the devastating effects of these sanctions on, again, maternal and child health, largely healthcare system in general, which prior to the first Gulf War, was one of the best healthcare systems, in the Middle East, certainly. And yet, Saddam never, had to give up his palaces, or the other senior Ba'ath Party members. So again, it seemed like our sanctions just hurt the most vulnerable people and really didn't do anything, to change, the Ba'ath Party regime's behavior.
So the international teams that were sent in to Iraq to monitor the impact on the human population, there have obviously been books written about it, but the UN lawyer who headed up one of those missions, that case example is one of the main reasons why the Human Rights Council is now trying to come up with a systematic way of assessing these things, because every team that was sent into Iraq had a different system for evaluating what was happening in the country, had a different system of metrics and human health indicators that they were tracking in terms of what was happening to the human population. And when you're sending in a team from the United Nations every, what is it? I don't know how often they were sending it, but every team was tasked with coming up with their own system of indicators of what was happening in the country. And then we learn the massive humanitarian toll of that regime. So I don't know if that speaks to what you were trying to point to, Dean.
Thank you. Harold?
Thanks, Ruth. Great talk. Wanted to follow up and ask again a little bit more about what's in the report in terms of whether there was a discussion around a couple different elements of sanctions theory, such as it is. And here, it's been a while since I've looked at it. I'm thinking mostly of the work of Dan Dresner, which first of all indicates that sanctions tend to be more effective the more people participate in the sanctions regime, which would seem to, and states know this is why they try to build coalitions, like in the case of Venezuela, to try to include as many possible sanctioning countries in the regime that's in the system that's targeting a country for a change in behavior. The other thing is the targeted state has an incentive, especially when they foresee conflict in the future with those that are targeting them, to hold out as long as possible, the way Saddam did. Because, well, there are two reasons. One is to not be seen as pushovers and therefore easy targets for sanctions in the future, but also because they don't necessarily believe, this is sort of Reed Polly's work on sort of, they don't believe the sanctions would be lifted even if they did change their behavior. So this might affect your design, this idea of maybe tweaking the sanctions in certain different ways to avoid causing these effects. There's these kind of these larger political considerations and mechanisms at work that would tend to lead states to not want to place limits on sanctions, or in the case of the targeted state, to accommodate, let's say the US, we'll still deliver aid, but to the population instead of through the government. They might have incentive, no, we're gonna hold out because we're a sovereign country and we don't want to be seen as pushovers.
So your suggestion here, Harold, is that these pieces be incorporated into how the Human Rights Council builds the model that is available to each of the nations when they're designing the sanctioning regime, so that they can consider what, when we sit down on Thursday, maybe you can walk me through what you just said again. And
no, it's just that there might be incentives for the countries that are most likely to use sanctions, such as the United States, to resist certain aspects of the model, which might be, say, the sort of political considerations around this that might lead them to resist the idea of tailoring or targeting in certain ways that you might end up advocating because of the way that they understand when sanctions are effective and when they're not.
Right. But I think like part of, I guess there's two pieces here. There's a divide between what the two pieces of work that I presented to you here. The first being the piece of work on the aid sanctions, and the second to the Human Rights Council. The problem with the work with the Human Rights Council is, I'm sure that Alan can speak more to this, but is that the motivation by the Human Rights Council is the complete cessation of use of unilateral coercive measures. And by complete, I mean total, that it is a violation of international law. The only thing legal in international law is multilateral coercive measures, those mandated by the UN Security Council. So I don't know. I mean, I think that it's an essential piece of what I should be understanding and arguing as an academic, but I don't think that will go into. But I do think that it's important for me to incorporate that, especially in my work, whether or not, because sanctions. Your point about nations working collectively with as many nation states coming in like coalitions, right? Like that's an essential response. Like when Putin lines up tanks on the border, I mean, like we need coalitions of every country to provide a response that is without a reasonable doubt no, and we will sanction you within, like with every measure that we've got, right? But that's not what the UN is shooting for.
I have a, oh, you have a two finger. Please go ahead.
One
Of
finger.
course.
Okay.
Just introduce yourself, please,
Sure.
for the people online.
Yeah, my name is Melissa Salm. I'm a biosecurity postdoctoral fellow here at CSAC. I think that you're awesome. That what you're doing is awesome and inspiring. I had a few associations after Harold spoke. I'll start. So, like, one question is like, where do you like? Who provides like the kind of health surveillance data? Is it like from the in country that is the target country, and then who's identifying the strategic vulnerabilities? Is that like a collaborative or a joint process, or is that more of like an external thing? The reason I'm curious about that is because it's having this association, and forgive me for sounding cynical, but there was a lot of news like during COVID when there were people, the Americans are dying, and whether there were rumors that the numbers of people dying because of COVID were inflated. Like maybe someone like had a heart attack but also had COVID, and then they got marked as COVID. And I'm not speaking to the veracity of that, but it was in the public discourse for quite some time in this country about the possibility of inflating that, and there were incentives for doing so because it could bring in money to hospitals or at the state level. So I'm having like this weird cynical association of like, could countries amplify, exaggerate the toll, the public health burden in this particular area as a way to get a sanction lifted earlier, or what would make a country willing to reveal potential vulnerabilities? I have in mind here the work that I participated in with the Global Health Security Agenda and the Joint Evaluation Tool, where countries were very scared to air their dirty laundry on what their the weaknesses in their systems are, because like, who knows, like maybe it'll impact their tourism.
Yeah, I remember that presentation.
So, I guess it's a question about maybe kind of more some of incentives to exploit this otherwise like very humanitarian focused intervention.
It's a good question, and it's echoed on some of the online questions as well about the incentives or disincentives for accurate reporting of maternal and child health outcomes.
Yeah, so your question like hits a spot that's troubled me for many a decade since I started doing global health work overseas. So just to provide a brief overview of how data is collected in kind of those channels. So the ministries of health that collect demographic health surveys, and those demographic health surveys on various metrics of health are sent to the World Health Organization. Whether or not countries are improving in like the sustainability development goals, that can have, and Paul can probably wise that you chime in a little bit here, can impact whether or not they're getting funding from international bodies for advancing health programs in the country. So like I've seen firsthand where the numbers that are coming out of the World Health Organization are like actually not what I'm seeing while I'm there on the ground. And I think that there's incentives for nation states that are really struggling to both provide a rosier picture of what's happening or to make it sound worse. I mean, that's less common. And perhaps, Paul, you can speak to that. But it's a problem. And one of the ways the international community has dealt with this is the UNICEF has the multiple indicator cluster survey, the mix survey. They're really expensive to do. They send in experts in data collection. They have 30 pages of metrics that they're going to collect on the country. They collect it across everything. They go back if they've gone to a household and there's some inconsistency in the data. And that sort of health data is amazing. Those mixed surveys from UNICEF. Now, the problem is, number one, they're very expensive. Number two, they're not done all the time because of A, and they're only done in certain countries. So the ones that probably need this data the most, you're not sending UN folks in to do extensive health surveys, which is part of why Paul and I are helping the UN with this, because it's about how you do these flash surveys for health with small teams of people, or how you can use other ways of tracking what's happening in a country to get reliable data. So your questions, yeah, thank you.
To just add also that there are efforts, some at Stanford, to create new sensing technologies that can estimate the impact on population health. They're almost always proxies for mortality, certainly maternal and child mortality. But there are people looking for ways to assess population health outcomes without requiring on-the-ground surveys or the use of vital statistics run by a government that has a lot at stake with reporting either elevations, reductions, or no change in health outcomes. Yes. We have a good question from Melanie Hannibal online, which is, what are the alternatives to sanctions in the real world?
Yeah, thank you for your question, Melanie. I think I should look up here. She's up there, I think. Hi, Melanie. So as I shared in my response, the Human Rights Council and the international lawyers at the Human Rights Council, the statements that are made are that unilateral coercive measures should never be used and that they're illegal. I don't think that there is an alternative, nor should there be an alternative to sanction use as part of the geopolitical toolkit. I think that they are, I mean, to me in reality, it doesn't make sense to consider a world order in which you have diplomacy and then you have military intervention without anything in between. So my view is that they're essential tools, that they should be used. There's data out there that some of these sanctioning tools are highly problematic. The complete blockades of ports, that's one. Total economic embargoes, that's another. But we're designing different tools, and part of the reason why I've been doing this work on one type of sanction is that if we understand how that one sanction works, then we can do that for the entire toolkit, right? And then we have an understanding broadly of how this suite of tools works and when to use them against which countries and why, and what we want to be watching for. So my answer to your question is my professional and academic opinion is that they're essential and that there isn't an alternative, that we should be using them.
Please, please introduce yourself.
I'm Norman Naymark. I'm here at
Here comes
CSAC.
your microphone.
Oh. I'm Norman Naymark. I'm here at CSAC and also in the history department. One of the things I kept thinking about is I'm not a social scientist. I guess I would consider myself a humanist more than a social scientist, but it goes back and forth. But the question I kept thinking about as you were talking, and you too, Paul, I mean, it's for you too, because this is your work. What difference does accurate data make? In other words, do you have demonstrable cases where you went to people and you said, this is the exact number of people we know who are going to die from imposing certain kinds of sanctions, and they said, oh my God, we're not going to impose those sanctions then? In other words, is there a way to somehow show that, let's say you had the most perfect data in the world, would that change markedly, you know, the way people use and impose sanctions, which are fundamentally, in my understanding, political, right? And have to do with the international system and political change and how regimes are punished for certain kinds of actions.
So, I mean, it's a beautiful question. And my answer to your question is this. So I'm a maternal and child health scholar. I met Scott on my first day of my postdoc, and Scott said to me, you know, Ruth, like, I think this CSAC training program will really help you, because in part it's training scholars early in their career, like me, how to bridge from, you know, I can write a publication, I can do the research, but I showed my first policy brief to President Rose, to a friend of mine who's a political scientist who's briefed Congress numerous times, and her response to me was, that's abysmal, like, do it again, you can't write that, you know. And so my answer to your question is that training programs like this are designed to take academics like my colleagues in this room, like me, and train us so that we can sit in front of a senior government official at the US State Department, that we're trained if we started getting yelled at minute one, and that we can explain what's going to happen. And I think that, firstly, that's a challenging jump, because you're working across, like, the language is even totally different. I've been coached in that. So I think it's going to happen. I mean, that's part of what I'm here to do. This is step one. Step two is get the training, and step three is go give it a shot.
So if I could
of course.
also comment, to me, this is a targeting exercise. Again, thinking about kinetic effects, you've got direct effects, you're going to use military force, you may have collateral damage, it has to fit a whole set of rules. My concern has always been more on the indirect effects, the destruction of the essentials of life. So if you hit a railway station at 2 a.m., because it's only the night watchman instead of thousands of people there during the day, the targeting decision, you have one direct death. But that train station is where all the food comes in for the whole region. The indirect deaths are always dwarfing the direct effects. In a sense, this is a kind of targeting of indirect effects exercise. So people can always make the decision to attack kinetically or use the sanctions, knowing that it's going to have an impact on vulnerable, innocent, non-combatant, if you will, populations. However, it's our obligation to make sure they know that, so that they know the human costs of their targeting and present alternatives that we know empirically are likely to be associated with fewer indirect effects on the non-combatants or the innocent populations. So it's an analytic question that has roots in theory, but also empirical, analytic, quantitative aspects that Ruth is really pioneering with colleagues around the country and now around the world. But I come back to the question I asked before. There have been a lot of international law analyses of sanctions, but they don't seem adequate to help with this kind of conversation. And I keep coming back to the analogs or the components of just war theory, if you will, and beginning to apply them to a non-kinetic space, like geopolitical sanctions, to give us some grounding on how we should think about, if not argue, the quantitative findings in ways that are theoretically or ethically based. And I raise this as a question for experts in this room, because I think in the end, Ruth's work is going to generate those kinds of questions, because it's going to say that these geopolitical sanctions are still lethal, which means you have to think about it in these kinds of terms. Please.
I guess I would just add that I think I'd encourage pressing on the ethics, just war doctrine side more than the legal side, because
Alan's upset.
Because proportionality, as Alan has taught me, is not
Doesn't apply.
a rule. It's a standard that you
Yeah.
have to measure. And indeed, the Geneva Conventions even made it a negative standard. That is, you have to say it's not disproportionate, right? And then you say, well, what's the value? You're comparing the collateral damage to something else. What the law would, it would permit all sorts of actions if you think that the goal of having a free election or changing Saddam's behavior is really important. What ethics would tell you is that you're making a really big choice with very inadequate measures of, in the military, you say, what's your collateral damage estimator? And they'll have the bomb size and they'll have the population. And we're doing sanctions without having a collateral damage estimator.
Yeah.
And what you're doing, I think, is using models to come up with a collateral damage estimator. You can't tell them the collateral damage isn't worth it. You can tell them you're not measuring it really well, and to make a good decision, you can't do a good job at this until you get this right, and that's powerful, really powerful.
This is
it powerful? In other words, my question is, if you could demonstrate this, would it make difference in decisions like that?
You know what makes huge differences?
I don't know how many I don't know how many academics.
You know that militarily, it makes a difference.
Knows this. You know this.
Yeah.
From experience and from history, that these kinds of decisions are horrible for children and for mothers. I mean, so if you make the decision anyway, isn't that right? I mean,
some do and some don't.
I don't know the number of
examples. That's what I was asking.
Well, there are lots of examples where leaders make a decision not to target a particular target kinetically because the collateral damage is too big. Look at the change in dropping collateral damage per drone attack under the Obama administration compared to the Bush administration.
Yeah, even courageous restraint as a strategic intervention. I'm conscious of the time. No, this is really important conversation. We're going to have to continue this, and we're family here, so we can do that. But I want to give you last few words, Ruth, just to summarize your thoughts at this time.
Well, to answer the last discussion that we've had here, we would need someone from the State Department who's involved in the design of these sanction regimes to tell us whether or not he or she or that team has academics who are presenting collateral damage estimates based on the country that's going to be targeted. And my hypothesis is that they don't have those scholars coming to them. They don't have those estimates. I think that there's a my hypothesis is, my assumption is that there's, briefings on the nation, what's gone wrong, what should be done. But I don't, because that bridge, that's why programs like Bridging the Gap exist. Like, that's why we have programs like this at CSAC, because it's so hard to make that transition from the academic work that we're doing here to getting that in front of a policymaker. So yeah, I think it's going to make a difference.
I hope so, and we will find out. But thank you all, and thank you, Ruth.